Hello, everyone, and welcome to today's webinar, HIPAA Ask the Expert. I'm pleased to be your moderator today. My name is Lucy Railton, and I'm the VP of Marketing at Drummond. Joining me is Michael Zgourovski, Risk and Security Assessor at Drummond. Welcome, Michael.
Thank you, Lucy. Appreciate the intro.
Before we get started, today's session is a little different as there is no presentation. There's only live Q&A. Also, in the corners of your screen, there are two QR codes. One that will allow you to schedule a free HIPAA consultation, and the other is a special program and offer for companies just starting out on their HIPAA PCI or SOC 2 compliance. Okay, let's get started. First, we're going to start with some commonly asked questions, followed by questions asked ahead of time by our webinar registrants, and then get to your live questions. Michael, are you ready to get started?
Let's jump right into things.
Okay, perfect. Let's start with the very first question.
Perfect. What are the core HIPAA rules and how do they apply to different software developers, healthcare providers, and business associates? So high level, breaking down the different parts of the HIPAA rule, we have the privacy piece, the security piece, and breach notification. Starting off with privacy, really what this section talks about is how your customers' data is handled, the individual patients, the rights that they have as patients, and how they can protect their data, how they can request that data, amend that data, things along those lines. It also restricts as a business who you can and cannot share that data with, and any governing documents that might need to be in place, such as authorization from the patients themselves prior to sharing that data. We also have the pieces related to security, your standard logging, your identity access management, identifying vulnerabilities within your system, things along those lines. They're pretty standard from different security frameworks, but critical to making sure that you're staying off that breach list and protecting your customers' PHI. And then you also have the breach notification. I'm going to knock on wood here. Hopefully we don't have to talk about that too much, but organizations do need to know how to report any potential breaches to governing bodies, to HHS or potentially state or individual patients themselves or their third parties that they have signed BAAs with. So understanding from kind of a chain of command who those notifications need to go out to, what records were affected, things along those lines, they need to be documented within your organizations. And this goes to everyone, vendors, developers, cloud hosting providers. Sometimes we even see third-party call centers that assist with billing or potentially with setting up appointments. All of those rules trickle down throughout that quote-unquote chain of command and applies to really all organizations that receive that PHI. When does a technology company become a business associate under HIPAA? So again, any organization that receives, stores, or transmits PHI for a healthcare provider or a third party, basically on behalf of another organization, would fall under that business associate category, even if you never actually view that data. This is a common issue that we see sometimes where even a cloud hosting provider, for example, a smaller co-location that is assisting a business with hosting some of their infrastructure, if PHI resides on those systems that are managed by that co-location, and even if they're encrypted where they don't have the decryption keys to view that data, they still are responsible for some of the controls and requirements under privacy and under security, and they need to ensure that they have a business associate agreement in place with their third party to make sure that all entities are covered. And this is a formal document that you should have signed and should be periodically reviewed as there are changes to regulations. What are examples of protected health information that developers and clinic staff often overlook? We see a lot of different information get inputted to these systems that organizations are developing. And you have everything, names, emails, appointment dates, all sorts of very specific data that organizations need to store or track within these systems. From a development perspective, it's really important to note where within that application that data resides. A lot of times we see organizations from a development perspective are creating things like variables where patient names might be written to a record somewhere that's also might have patient notes, for example, right? If I'm speaking to a doctor or to a nurse and they're going to make a note on my account or on whatever EMR software, that data would fall under the security rule, and we're looking at logging least privileges also apply to that. And if you have these records potentially being written to the wrong areas of your application. Sometimes we even identify them in logs themselves. Obviously, that data is not going to be encrypted. It's not going to follow the same standards as your main structured data for your application. So it's really important to note that you're not making any mistakes sending that data to other parts of the application which don't follow the same safeguards as your main structured databases or other potential storage locations. So that's one of the biggest pieces that we see, just understanding where your data is within your application. Can we use cloud services or communication tools and still stay HIPAA compliant? And the answer is absolutely. Obviously, we live in a world nowadays where organizations are leveraging third parties more and more. Again, this goes back to the BAA piece, having that business associate agreement, having that signed. You also definitely need to do your due diligence because organizations, although they might have a BAA, it's a good idea to double check yourself. Hey, what do you do as an organization to ensure that you're protecting your customers' PHI? And how do we have assurance that our PHI is being securely stored within your system? So as long as you have that BAA, do your due diligence and have those open lines of communication. Cloud service providers, we mentioned some VoIP providers as well. You might have phone calls that you're going to be transmitting PHI over. You can totally have a BAA in place with them and leverage them as a third party to ease the implementation burden on your organization while still maintaining those services. What key security practices should every HIPAA compliant system have? And we're really just going to drill down into the basic security practices and security domains, right? You have the CIA triad, confidentiality, integrity, and availability, right? Confidentiality, we're going to want to have the least privilege access as possible. And then you also want to combine that with minimum necessary, right? So even if you have the least privilege and I only need to have access to this data, although I might need to have access to a specific patient's data records, I might not have to access all of them, right? If I'm an optometrist, I only need to see their charts to that specific data. I don't need to see their entire record if it's not pertinent to the care that I'm providing to them. Same thing goes for like billing rules, for example. I don't necessarily need to see the entire patient's record if I'm just billing them for a particular service. So least privileges combined with minimum necessary, that's huge and a cornerstone. Integrity as well, this also overlaps with confidentiality. Again, encryption. There's standards for encryption that are out there, making sure that any data at rest is being protected. It's being encrypted either by a partition level or at a column level within a table, whatever that might be. And then also within transmission, right? We're looking at TLS 1.2, TLS 1.3, industry standards. While you're sending that data, you're making sure that you're not subjecting your applications to man-in-the-middle attacks, making sure that even if somebody's listening, that data is not transparent to them and it's being protected. We also like to jump into some multi-factor. Passwords are not necessarily the greatest way to authenticate someone. Making sure that you have that multi-factor, whether that be a physical token that you have, we're starting to see a lot of that, or even just SMS or something like Duo. It's a great way for one-time passwords to make sure that even if those passwords are compromised, you have that additional layer of protection. And then we also jump into general audit logging and reviewing those systems, right? So it's great that you might have audit logging for your application. If you're not reviewing it, really isn't providing much of a benefit to your organization. So doing some sort of a SIEM or something along those lines where you can have thresholds set where, hey, rate limiting is going on here, or somebody's accessing way more than what is the normal amount of patient records, something that can throw up some alarms that your organization can review and identify any potential unauthorized access to those systems. And then the final big piece that we have is doing some sort of a risk assessment, not only just the security piece, because obviously that's critical, but business risk assessments as well, looking at your vendors, assessing any potential BAAs, who essentially has hands within your systems, when we're looking at third parties. So an annual risk assessment or security risk assessment is critical. Not only is it a requirement, but taking that action very seriously can have a very profound impact on your organization. How should testing or demo environments handle patient data? The best way to answer this is just to make sure that you don't have patient data in test accounts or test environments. A lot of times, more developers are going to have access, more UAT users are going to have access. You have QA as well. So there's a lot of individuals who have potentially privileged access to these systems. So if they're going to have privileged access and they don't have that business justification to actually see medical records, it's probably the best idea to not have actual data, have test data, structured data that can emulate real patient data and can allow your organization to go through regular testing, but without having that actual medical records in that test environment, because some of those security baselines may be lowered a little bit for those test environments. What's the right way to handle consent and patient communications, especially for telehealth or mental health services? So patients really need to understand how you're going to be communicating with them. And this actually is another question that came up. It's, again, we're going back to minimum necessary as far as patient communications go. Emailing or texting is very common, especially if they're providing consent. We also go back to that TPO piece where authorizations, if it's specifically to fulfill that TPO, may not be necessary, but you always want to make sure that as an organization, you're minimizing any data that you're sending through emails or through texts. Avoiding those sensitive details. You don't want to text a patient and say, hey, these are your test results. I think that we should take these actions, things like that. Just say, hey, your results came in. Either give us a call or go ahead and log into a secure portal where you can view these results. That way, they're going to go through their logins, MFA potentially, and they're going to view that data in a secure manner. So try to keep that data outside of those communication channels if possible. What should a clinic or vendor do if a potential data breach or unauthorized access occurs? So the first thing would generally be to go through your incident response plan, right? You should have documented means to identify the threats and contain the issue, and that should be documented within your incident response plan. At that point, you can go through some sort of a remediation or cleanup process to make sure any unauthorized access is officially removed and you're going back as an organization to a known good state. So you're starting off with stop the bleed, remediating the issue. And then throughout this whole process, you need to document exactly what happened, whether that be in a lessons learned or a post-mortem kind of incident report. You need to document all of this out. And as a part of that, it would be a good idea to identify an initial universe, so to speak, to identify what patient records were accessed. That's more of a forensic lens. Identifying after the fact, we just talked about logs, right? So making sure your organization has logs, and then after the incident occurred, going back and seeing who touched what records, who viewed or potentially modified any of these records. So you want to make sure that you're documenting that as well. And then we go as a part of the privacy rule and as a part of the breach notification rule. You're going to have to notify the individuals that were affected. And then depending on how many records were impacted, you may have to reach out to regulators to let them know. And that's not just the HHS. You might have state regulators or other local regulators that you do need to notify. And then not to mention, if you are a vendor of some sort that's providing a service, you might need to notify the organization that you actively have a signed BAA with to let them know, hey, we were working with your customers' records, there was unauthorized access, they were potentially exfiltrated, accessed, modified, things like that. You have to let them know and notify them through a letter or email notification, something along those lines. How does HIPAA compliance apply to newer technologies like AI, wearables, or Fire APIs? So whether we like it or not, it's going to apply to all three. You need to make sure that any pieces of technology that are touching any PHI, they need to follow HIPAA compliance. AI has always been a hot button topic, and my best advice that I have to organization is treat it like any other application, whether that be self-hosted, right? We're seeing a lot of organizations that are hosting AIs locally or within their own data centers or cloud providers where they own, quote unquote, the keys to the kingdom. The databases or data sets that the AI actually interacts with is technically local to them. They own that data and it's not really reaching out to a third party. It's staying in its own bubble, so to speak. So that's a great way, and you have full control over any of the specific requirements that HIPAA mandates, which that's a great way to approach things. Now, that's not always the case. You may need to leverage a third party AI provider where you're using API keys and you're making calls. And this goes right back to our BAAs, right? If you're going to leverage a third party, you need to make sure that they are following all of the HIPAA rules, and that includes both the privacy piece as well as the security piece. So if they're going to be providing you that service, again, doing that due diligence, understanding what they're doing to protect customer records, and having those BAAs signed for any AI providers, it's going to follow the same step there. And potentially, if you're using it for research, right, we're starting to see de-identified data being used if possible. It's not always the case depending on the integration. So if that is an option for your organization, that can give you an additional layer of shielding when you're going through that. As for FHIR APIs, wearables, the standard authentication, authorization, access controls, they all still apply, right? It may be a little bit of a different implementation, but all of those controls will still be there. And you need to make sure that you're validating that they're in place and periodically testing those controls. What are the most common mistakes that lead to HIPAA violations, and how can they be avoided? We get to see a lot of different organizations, so we see a lot of different gaps. And although they can be very different at some points, we also see a lot of the same issues time and time again. Shared logins, weak passwords, not requiring users to rotate their passwords. Those are very common things that we see, especially with in-person environments. We see it a lot with pharmacies. Pharmacies tend to be really bad because people are constantly jumping on and off computers. They're running around interacting with customers. So, they want to have the shortest password possible, or potentially just a PIN code. So if you are accessing these systems, consider either adding an additional factor or beefing up some of the security on password requirements to make sure that people aren't accessing other people's sessions, and having those unique identifiers for each individual. That's critical. We also see a lot with misconfigured storage in general, both in cloud and on-prem. A lot of organizations migrated to the cloud over the last few years here, and although their applications might have intrinsic encryption, some of that may have changed over time, which is why it's important for any organization to review their controls over time, right? Year over year, to make sure that nothing gets missed or slips through the cracks. But we see a lot with misconfigured storage, not having the appropriate encryption in place, having too many users that have access to it, things like that. That's a very big pain point that we see. Another massive pain point is PHI in unencrypted email. We see it in test data. We've also seen it in recordings, phone call recordings from a contact center. People don't realize it, but even some of the things that people talk to from a customer support perspective might have PHI within it. So if that's being stored clear text and X number of users have access to the recordings, although it's unlikely to cause a breach, it is still a area where the organization is housing PHI. So making sure that those are encrypted and minimum necessary and then least access is very important there. And the same thing with unencrypted email. There's so many solutions out there with third parties to provide encrypted email, or to use a quote unquote eFax solution. Many of them do offer BAAs. They're very used to handling PHI, and they work very closely with a lot of organizations within the healthcare field. So they know how to implement these things and allow your organization to continue to use email without having to do a massive migration or a large change in workflows. And then the last big thing that we see is a lack of training. And this goes across the board, right? We mentioned the three main pillars: breach notification, privacy, and security. A lot of times what we see is organizations, they'll nail one or two of the three, but they won't cover all three. And it's really important. The privacy, the end users that are providing care or are interacting with those patient records, they need to know what they can and cannot do, who they can and cannot disclose data to, under what circumstances they can modify it, how to document those requests. The security, making sure you're not clicking on stuff, you're changing your passwords using long, strong, secure passwords, things along those lines. And then also breach notification, right? A lot of times we think of breach notification, hey, that's the privacy officer's responsibility. That's not my job. At the end of the day, it's the responsibility of everybody within the organization. If you see something, say something sort of scenario where if you see something that, hey, somebody's touching these records they're not supposed to be touching, or modifying things without verifying with the patient, things along those lines. Most organizations have some sort of a like help desk or compliance hotline that you can give a call, or you can just reach out to your privacy officer. But this needs to be disseminated to end users throughout training, and that should be an ongoing thing. It's not a one and done. You need to make sure that you're reinforcing these concepts back to your employees to make sure that they understand and they know how to comply with all these regulations.
Thanks, Michael. Those are some great frequently asked questions. We're going to move on now to the questions that webinar registrants asked as they were registering for the webinar. There's about 6 of those. And so this is a great time for our live attendees to start asking their questions in the comments, because we're going to be asking those next.
Perfect. When does patient consent need to occur when using PII, PHI in a workflow for rendering services to benefit the patient? I'll take it a little bit from the opposite viewpoint, right? We mentioned TPO earlier, treatment, payment, and operations. Those are the 3 main areas that you don't really need authorization. Anything beyond the scope of that, you should just assume that you need written consent. We see the marketing communications, any disclosures to third parties that aren't involved with that TPO piece. We also see very specific rules for psychotherapy notes. So anytime that those are handled, expect to have some sort of an authorization or consent form to be filled out. And then it's also important to note the state-specific regulations. I know those are constantly changing, but you need to identify which specific state you're operating in. We see so much with reproductive, behavioral, substance abuse, and a lot of those states, individual states, have their own requirements for authorization surrounding care within those categories. So definitely check your state regulations. But to answer the question at a high level, TPO is the only time that you don't really need as granular authorization. We do still see organizations go for authorization during those times, but if you're within treatment, payment, or operations for those organizations that are providing that primary care, you don't really necessarily need that under the privacy or security rule. For appointments and billing reminders via text, SMS, or email, what can we include and what must not be included? Is a great question. Again, we touched upon this earlier. Try to keep it to the minimum necessary. So the least information that you can provide to still get the message across to your patients, I would say that's the best way to approach it. Patient name or initials, maybe. Chances are you can just say, hey, we're XYZ organization. We have your results, or we have your appointment. Hey, you have a bill that's due. Just keep it high level. You can provide a callback number and say, hey, if you have any questions, give us a call back, or log into the portal to actually view your information. Definitely don't provide any PHI within those if possible. Diagnoses, conditions, treatments, specific information about medication, just omit all of that. Don't send that through email or text messages. At the end of the day, it is an unencrypted method to send information. That's something that we try to avoid, and it is technically a requirement under the HIPAA security rule. So trying to anonymize the information as much as possible is definitely the right way to go about doing things. How does HIPAA relate to emerging state regulations requiring data segmentation for certain care, i.e. reproductive health? Are EHR vendors required to comply with state regs if not mandated by HIPAA? Think of HIPAA as basically the baseline, right? You're not going to be able to get out of HIPAA if you're operating within the United States or handling that PHI for American citizens within the contiguous United States. For the individual states, what we've seen is that it meets or exceeds HIPAA. We don't see anything that directly impacts HIPAA where you can only follow the state or you can follow HIPAA, right? If anything, it's an addition to the existing HIPAA requirements. Definitely check with the specific states that you're operating in or the states that you have customers or patients in. That's going to be the biggest thing. And reproductive health has really been a hot button topic. Again, I'll go back to behavioral health. That's also been a very niche area, substance abuse, psychotherapy, things along those lines. All of All of those are called out within HIPAA, but many of the states are going to have specific requirements to that. So definitely check with the state requirements. Unfortunately, you're not going to be able to get out of HIPAA. How should annual security risk analysis for MIPS PI reporting be performed? So I believe that this is for CMS, and you're referring to the security risk analysis that you have to submit, I believe it's annually. And my biggest advice would be to do your risk assessment to an existing known standard. If you use, I like to use NIST personally within our organization, within Drummond. We try to push for that within different customers that we have. A lot of times we see the 853 framework or standard out there. There is, I believe, 800-30, where you can use them for risk assessments. But 800-53 is a kind of a good baseline, moderate, light, moderate, high, that you can pull some controls, identify, yes, the standard is pass fail in the way that it's set up, but you can use it as a risk assessment. Are we doing these things? Do we see a low risk with these controls? Do they lower the risk of the organization? And having that documented. And with that, once you have a known set of control areas that you want to cover, you can see year over year where you're improving or potentially degrading as an organization and try to plan to address that. We see that this is something that's commonly accepted by CMS because it's a very known standard. 800-53 is used for a lot of authority to operate within different governmental organizations. So they're familiar with it, they understand the controls, and it's become the golden standard. So that's one area. I believe the ONC also has a toolkit. That's another common area that you can go down to perform your annual security risk analysis. But just identifying where your PHI is, addressing those risks, finding out your controls, documenting your internal organizational controls, and documenting those findings. They're standardized regardless of which kind of framework or standard you go with. I just like to recommend 853. What are HIPAA security rule expectations as they pertain to AI? What controls are expected to be in place and will be a part of the SRA next year? So currently, HIPAA security rule doesn't have anything specific to AI. Again, I'll go back to the previous comment that I made regarding AI, where treat it like any other application, right? You have your standardized hardening standards for any application. You want to treat AI the exact same way, encrypting that data, making sure you're limiting access to only the users that need to be there. Realistically, it follows in tune with everything else that you're already doing as an organization. So just making sure that you have those controls in place. Just because it's AI, don't think that it needs to take a different approach. Limiting who you're sharing that data with, especially if there's a third party, making sure that there's a BAA there, and they're protecting your customers' data as well. You should be just fine, and make sure that you document those controls in the same way that you are with any other potential applications in your environment. In general, for an RCM IT platform, what it takes to be HIPAA compliant, a cheat sheet or overview to help us make progress towards compliance. The Drummond website actually has a resources tab. If you would like to head over there, under the resources tab, there is actually a HIPAA cheat sheet. You just got to enter in your email and it'll send it over to you. We've also got to either side of me, there's the free consultations. If you want to hop on a quick call, just discuss some of your potential pain points, identify where you think your organization has issues. We're more than happy to do that, talk through a few of your controls. And if you want to go through an assessment, we can talk about what that process looks like.
Thanks, Michael. We're done all of the kind of pre-questions that we got from our registrants, and now we're going to move on to some of our live questions. The first one is, can you elaborate on the scope of HIPAA for RCM platforms?
Yeah, I think we just covered that. Revenue cycle management is like any other platform under HIPAA, right? You're expected to have billing information. There's potentially services that you're providing, and likely there's going to be PHI there. It's not really going to be any different to any of the other HIPAA rules. You don't get a buy just because you don't have X data within your platform. It still falls under PHI, and HHS does have a governing call out to what is considered PHI, so definitely check out their website. But if you fall under those categories, you definitely need to adhere to HIPAA, because you do potentially have PHI within your platforms. How does HIPAA apply differently to mental health clinics compared to general medical practices? The HIPAA security rule and the breach notification rule to mental health clinics is exactly the same. There's no changes there. Where we get into things a little differently is going to be the privacy rule. Psychotherapy notes, mental health notes, those are considered a little bit more privileged, and you're probably aware of that if you work in the industry. So there are specific requirements. You can't really share those, right? Those don't fall under TPO, or they don't fall under, hey, can we share this with a third party? Those notes are privileged, confidential, and you can't really share those, even if there is authorization. Same thing with, there are some considerations there, even with law enforcement, right? They can request that data, but you need to make sure that there's specific rights to where those are confidential, even under subpoena. There may be cases where you don't have to provide those. Can you elaborate on HIPAA considerations specific to integration process during a full data migration from an existing EHR when a customer switches vendors? Realistically, the biggest thing, anytime an organization undergoes a significant change, what I'm going to recommend is just to crosswalk all of the controls that you have in place. Running through, having a checklist of, again, minimum, I'm repeating myself here, they're the same controls: minimum necessary, multi-factor, strong passwords, logging, audit logging, retention of that data, things like that. Unfortunately, you're going to have to go through almost like an audit process all over again. When you do that migration, and once that new environment is stood up, you want to make sure that you're not missing any of those controls. It's very easy to miss those. Given the fact that they're using a vendor, if they're a reputable vendor, they are going to have those BAAs. They're going to do their own internal testing to make sure they're providing their customers a quote unquote compliant platform. So that can provide you a little bit of assurance, but ultimately the organization that's leveraging those vendors should validate that information themselves, making sure they're not missing any controls. Where do most organizations fall short when it comes to maintaining HIPAA compliance over time? I would say the biggest thing is organizations grow, new applications get deployed or developed, and those don't get validated. Again, strongly advised for organization at a minimum on an annual basis to review their systems to make sure that they're not missing any items from HIPAA security or privacy rule. Same thing goes for a breach notification. That kind of includes the privacy officer a little bit more, potentially even inside or outside counsel to help review some of those documents. But we see over time, some of these controls get missed, and there's changes that are introduced into internally developed applications a lot of times, and something gets missed or changed, and nobody goes back to make sure that those items are covered. So as long as you have some sort of an audit process to make sure these items aren't being missed, I think you should be pretty well covered. How often should clinics review or update their HIPAA policies and procedures? Golden standard is annually. A lot of times that's going to be a rolling process, right? You're not going to sit down and review all of them at once, but throughout the year, you should make sure that your documents are being reviewed, updated. The biggest thing that we like to see is to have a review log at the bottom of your documents to see who signed off on it, what changes were made, an edit log within the document itself. That way you can know, hey, this was reviewed at January of last year. Let's go ahead and review this on this upcoming review cycle to make sure that those documents don't become too out of date. The other thing is, if there's a major change to the business, mergers, acquisitions happen all the time. New applications get deployed, new business lines where you're providing different types of care. Anytime something like that happens, would probably be a good idea to also review those policies at that point. How can leadership teams make HIPAA compliance a part of their organization's everyday culture? We talked about training. There's a lot of existing training platforms that are out there. That's great from a checkbox perspective where you're going to provide training to your individual employees, assign it to them. Great, go ahead, get your certificate of completion, make sure that's happening on an ongoing basis. But that doesn't really stimulate employees to make sure that it's part of their culture. I totally agree with that. So one of the biggest things is that some of the organizations that I've seen that are very successful with their programs is doing little things like lunch and learns. Everybody loves free lunch. If you're going to sit down at a round table, get out some sandwiches and have your privacy officer or somebody from IT come out and talk to people, these are ways that you can protect your customers' data. We tend to see that they're more attentive having bulletins, occasional emails that get sent out, say, hey, this is what's going on in the HIPAA world, or security sent out this notification, watch out for these phishing links, things like that. This is ways that they're attacking your patients. So having that ongoing thing, trying to make it a little bit more personal, especially if you're working in person, it's very easy. Do a quick huddle. Hey, we want to chat about this real quick. Helps make it more of a culture thing rather than a checkbox thing.
Thanks, Michael. We've come to the end of our questions from the audiences. Thank you very much for joining us and for engaging us with your questions. And Michael, thank you very much for sharing your expertise.
Not a problem. Thanks everyone for joining.